A mother calls 911. Her daughter thought she was taking a simple pain pill, but instead, she's fighting for her life. The culprit? Fentanyl. Fentanyl is not just another substance. It's an invisible killer lurking in everyday pills. You've probably heard about this crisis, but here's the scary part. You may be taking fentanyl without even knowing it. Cartels are flooding the streets with fentanyl-laced pills disguised as common medications, and the death toll is climbing at record speed. Just 2 milligrams is enough to kill. That's barely the size of a few grains of salt. Today on Politalysis, we uncover how decades of big pharma greed, flawed FDA approvals, and ruthless trafficking created an opioid epidemic that has ripped through America in 4 devastating waves and might unleash a 5th. Let's get right into it.
Recent overdoses are shining a spotlight on the trouble of opioids in the Central Valley.
Not 1, but 2 kids that were foaming at the mouth, gray, purple, completely unresponsive.
The opioid crisis didn't appear overnight. It began in the 1990s, when pharmaceutical companies like Purdue Pharma aggressively marketed substance like Oxycontin as safe and non-addictive. Big Pharma flooded conferences with data that downplayed addiction risks and incentivized physicians to write more prescriptions. They sponsored lavish events, funded misleading studies, and provided financial kickbacks, creating a system where profit overshadowed patient safety. Their marketing campaigns targeted both doctors and patients, portraying opioids as a safe, effective solution for pain relief while concealing the devastating consequences of addiction. By 1999, the first wave of the epidemic was underway. Prescription opioid use skyrocketed, leading to dependence and addiction. Between 1999 and 2020, over 600,000 opioid-related deaths were recorded in the U.S. alone. As regulations tightened and prescriptions became harder to obtain, patients began seeking alternatives, setting the stage for the second wave of the crisis. Experts define the opioid crisis in 4 distinct waves. Wave 1, 1990s. Prescription opioids, like Oxycontin, skyrocket. Wave 2, 2000s. As prescriptions dry up, people shift to heroin, cheaper and easier to find. Wave 3, 2010s. Enter fentanyl, a synthetic opioid 50 to 100 times more potent than morphine. Wave 4, now. Carfentanil, an elephant tranquilizer 10,000 times stronger than morphine, is seeping into the streets. Just 1 gram can kill 50,000 people. The second wave hit in the 2000s as patients who could no longer obtain prescription opioids turned to heroin. This shift marked the beginning of a more dangerous phase, one that would soon give rise to an even deadlier wave: synthetic opioids. Come the 2010s. Fentanyl skyrocketed. Originally developed for severe cancer patients, it infiltrated the black market. Cartels discovered they could mass-produce fentanyl cheaply and covertly, mixing it with heroin or pressing it into fake pills. Many users had no idea they were ingesting a lethal dose. Between 2013 and 2024, fentanyl's spread has grown at an alarming rate. In 2013, approximately 1,200 kilograms of fentanyl and 2 million pills were seized, generating $2 billion in revenue and causing 3,105 deaths. By 2023, those figures had exploded to 18,000 kilograms and 60 million pills, valued at $60 billion, with 81,083 deaths. Projections for 2024 suggest a grim continuation, with seizures potentially reaching 20,000 kilograms and 70 million pills, valued at $70 billion, and deaths surpassing 85,000. Then there's carfentanil, a fentanyl analog developed as an elephant tranquilizer roughly 10,000 times more potent than morphine. By 2023, carfentanil-related deaths soared by 700%. Even a few grains can be catastrophic. From less than 1 kilogram seized in 2013, seizures jumped to an estimated 150 kilograms in 2024, valued at $7.5 billion on the street. Think about how many fatal doses that represents. If fentanyl's a weapon, carfentanil is an atomic bomb in pill form. A single gram of carfentanil can potentially exterminate 50,000 people. All this begs the question, how do we allow such powerful opioids to enter the market in the first place? The FDA's early approval of Oxycontin, despite flawed testing and pharmaceutical lobbying, further enabled the crisis to spread unchecked. Oxycontin hit the market in 1995 after receiving FDA approval, despite insufficient safety studies. Purdue marketed it aggressively, downplaying addiction risks and targeting doctors with misleading data. By 2013, enough opioids were prescribed to supply every adult in the United States with a full bottle. As prescriptions increased, so did addiction rates. When regulations tightened in the late 2000s, millions of patients turned to heroin as a cheaper, more accessible alternative. Mexican cartels quickly capitalized, flooding the U.S. with heroin laced with fentanyl. The synthetic opioid was cheaper to produce, easier to smuggle, and infinitely more potent. By 2017, synthetic opioids, primarily fentanyl, accounted for 59% of opioid-related deaths. In 2020, the COVID-19 pandemic accelerated the crisis. Isolation, job losses, and mental health struggles drove more people to substance abuse. Overdose deaths surged by 30% that year. Synthetic opioids were responsible for 93% of those fatalities. The rise of counterfeit pills, marketed as oxycodone, Xanax, or Percocet, has made fentanyl even deadlier. These pills, often laced with lethal doses, are sold online through social media, reaching teenagers and young adults with alarming ease. The opioid crisis has destroyed families. Substance deaths now beat deaths from car crashes and shootings combined. Yes, that's no mistake. Combined. Hospitals report more babies born addicted to opioids. Homelessness and unemployment keep rising. China is often cited as the source of precursor chemicals used to manufacture fentanyl. These chemicals go to Mexican cartels, like Sinaloa and CJNG, who process them in clandestine labs, then smuggle the final product into the U.S. A $3,600 chemical investment can produce $3 million worth of fentanyl. The profit is so high that gangs across the world are joining the trade, hidden in cars, cargo, even children's toys. These deadly pills flood our streets faster than law enforcement can intercept them. In 2023, over 17,000 pounds of fentanyl were seized at the border, enough to kill every American multiple times over. Yet, the supply keeps growing. Narcan, a life-saving opioid overdose reversal substance, has become a crucial tool in fighting this crisis. Emergency responders reported administering Narcan over 400,000 times in 2023 alone. However, fentanyl overdoses often require multiple doses, leaving first responders struggling to keep up. In some cases, victims have died despite being treated with Narcan immediately. Fighting the crisis is hard. Pharmacies gave out 2.1 million Narcan doses in 2023 to stop overdoses. Safe injection sites give substance users clean places to avoid deadly mistakes. Critics say this encourages substance use, but supporters argue it saves lives and helps people find treatment. Rehabilitation programs are overwhelmed, with many addicts unable to access treatment. Over 70% of addicts seeking help in 2023 reported being turned away due to lack of resources or insurance coverage. The financial toll of the crisis is staggering. The CDC estimates that opioid misuse costs the U.S. economy $1 trillion annually, including healthcare, lost productivity, and criminal justice expenses. Experts even predict another 1.2 million deaths by 2030 if the crisis continues. Federal funding of $46 billion supports prevention and treatment. Over 25 million Americans are in recovery, showing that treatment works. Community centers and schools now focus on education and support. But the staggering $1 trillion economic toll pales in comparison to the human cost. Parents burying children, communities shattered, and lives lost to addiction. Each number represents a family changed forever. The crisis has no boundaries. Rural and urban areas alike are reporting rising deaths. Whether you live in a rural corner of West Virginia or the bustling heart of Philadelphia, fentanyl doesn't discriminate. In West Virginia, the state with the highest overdose rate, 90% of substance-related fatalities involved fentanyl in 2023. Meanwhile, major cities like Philadelphia, San Francisco, and Chicago have seen entire neighborhoods transformed into open-air substance markets, where addiction and homelessness dominate the streets. Public health officials are calling for drastic action. Proposals include expanding access to medication-assisted treatment, increasing Narcan distribution, and implementing stricter penalties for trafficking fentanyl. Critics argue these measures only treat the symptoms, not the root causes. They point to the pharmaceutical industry's role in creating the crisis and demand accountability. In 2023, Purdue Pharma reached a $6 billion settlement for its role in the opioid epidemic. Beyond Purdue, consulting giant McKinsey & Company played a critical role, advising companies on how to turbocharge opioid sales, resulting in a $650 million settlement in 2024. While the funds are earmarked for prevention and recovery programs, many believe it's too little too late. Families devastated by addiction continue to fight for justice, but the damage caused by decades of negligence and greed cannot be undone overnight. After decades of flawed regulations, corporate greed, and shifting drug waves, the opioid crisis remains one of America's greatest challenges. With fentanyl and its deadly variants claiming more lives each year, the fight is far from over. The question is, will we keep pointing fingers or finally demand accountability from Big Pharma, the FDA, and our government? Will we stand by while cartels adapt their tactics or push for better border control and international cooperation? And will we invest in treatment, education, and harm reduction? Or let another generation fall victim? It can be your children or grandchildren. Victims' families want justice. Protests outside substance company offices demand answers. The crisis is about greed, failure, and broken systems. The people lost are more than numbers. They're parents, children, and friends. The fentanyl crisis grows worse while leaders argue. The cost of doing nothing is more deaths. Stopping this crisis means funding, education, and strong laws. Fentanyl is a silent predator, and the fight to stop it is just starting. Join us here on Politalysis for more in-depth investigations. Like and subscribe to stay informed on the issues that matter. Because stopping fentanyl and saving lives isn't just a policy choice, it's a moral imperative.